What is a pressure injury? A pressure injury is a skin injury caused by putting a lot of pressure onto a small area. They usually occur on areas where there are bones that are close to your skin, like your bottom and back when you are sitting or lying down. When pressure is put on an area, the blood is not able to get to your body's tissues. Like our brains and muscles, skin needs oxygen to stay healthy. Having less blood flow to those areas can cause serious damage to the tissues the longer it goes on. What may help cause a pressure injury? Factor 1. Surfaces. One of the most important things to remember is the surfaces you were sitting and lying on for a long time during the day and night. If you are not sure if what you are sitting on can cause a pressure injury, you should think about how the material type, size, and comfort affect how you sit or lie. Examples of the surfaces you should look at are your wheelchair, mattress, recliner, toilet seat, or bath seat. You should also see if there are any specific spots where you may feel more pressure. Factor 2. Aging. As you age, so does your skin. Your skin makes fewer collagen fibers, which keep your skin strong and help it heal. This means that you are more likely to get a pressure injury and that it will be harder for the pressure injury to go away. Right now, you may not get a pressure injury because your skin is strong and flexible, but getting into the habit of pressure relief when you are younger can help prevent serious pressure injuries throughout your life. Factor 3. Blood flow. Sometimes it is not about the amount of pressure on an area, but about the amount of oxygen that the tissue gets. If you lightly press onto your arm, you may see that your skin lightens up for a moment once you remove the pressure. This is what it can look like when your skin tissue does not have oxygen for a short time. Imagine what happens when you have put pressure on it for a long time. Other factors. Other factors that affect pressure injury risk are being too hot or wet, having very dry skin, how clean the skin and surfaces are, the ability to control your bladder and bowels, also known as incontinence, and nutrition. As there are many reasons someone may get a pressure injury, each one needs to be addressed to lower the risk of forming a pressure injury. What does a pressure injury look like? There are different stages of pressure injuries. At the first stage, the skin may be red or darker than normal, shiny, and may feel hard or warm to the touch. The change in color does not go away after an hour once the pressure has been taken away. The skin may also be very dry and cracked or have blisters or small bumps. As an injury develops, it may become an open wound and even potentially open deep enough to show the bone, muscle, or tendon underneath. Pressure injuries can be painful at any stage, and it's better to prevent them from opening when you can. How do you know if you have a pressure injury? Either you or a trusted care partner should check your skin regularly to try and find areas that get a lot of pressure before an injury starts. If you do not have feeling in your bottom, back, or other areas and they are painful, you should check every day. If you have diabetes, you should check your feet every day because they may be more likely to lose feeling. If possible, use a handheld or long-handled mirror to check your back and bottom to look for skin that is redder or darker than normal, especially where you can feel your bones press into your seat. This can be done while you are changing clothes or bathing. If you notice a spot that might be a pressure injury, take pressure off the area and keep an eye on it. If it does not return to normal after an hour, contact your healthcare provider. Pain can also be an indicator that a pressure injury is forming or opening. However, some people are in pain all the time, meaning they may not know if the pain they feel is a new or worsening pressure injury or their normal pain. For these people, if you notice an increase in pain in a bony area of your bottom or back, do a skin check to see if you need to talk with a healthcare provider. Who should you talk to if you are worried about a current or potential pressure injury? Option 1. Occupational therapist, physical therapist, or wheelchair specialist. A pressure injury may mean there is a problem with how you are sitting or lying down. OTs and PTs who specialize in seating and wheelchairs are trained to notice potential problems and give ideas on how to reduce the risk of pressure injuries in that area. If it is something that needs to be changed or added to your wheelchair or mattress, such as a new cushion, they may also be able to prescribe specific equipment depending on your insurance. Option 2. Registered dietitian nutritionist. Poor nutrition can also lead to an increased risk of pressure injuries, especially a diet that is low in protein. An RDN can look at your current diet and suggest ways to change it to better support your skin tissue. Option 3. Nursing staff. Nursing staff can help take care of fragile skin and pressure injuries. They can train you and your care partners on ways to clean and treat open pressure injuries. They can also talk about problems with moisture and cleanliness of the skin to create a comfortable sitting situation. Option 4. Physicians, physician's assistants, and nurse practitioners. Physicians, physician's assistants, and nurse practitioners can give prescriptions and referrals when you need more care. If pressure injuries open, they may have to be closed through surgery, and these professionals can give the needed recommendations and referrals. They can also prescribe medicine if needed to help things such as incontinence, managing pain, and controlling extra saliva. What is pressure relief? When you are sitting in any position, in any chair, your body weight and gravity cause the same amount of pressure on your back and bottom. If you put all that pressure on a small area, it can hurt the skin more than if it is spread out over a larger area. The goal of pressure relief is for you to move your body to spread the pressure out or remove it entirely. Pressure relief is used to make sure that blood and oxygen are getting to all your body's tissues and prevent pressure injuries from happening or getting worse. Pressure relief can happen in many ways based on what you can do physically with your supports. For example, some people find relief with options such as standing, leaning, reclining in a recliner, and tilting back in a power wheelchair. Types of pressure relief. If you can move your body on your own, you should do pressure relief every 15 to 30 minutes. If you need help, you should relieve pressure every 30 to 60 minutes. Each position should be held for 1 to 3 minutes for the blood to go back into the tissues. People who are weaker do not move as much during the day. The less often you engage in pressure relief, the longer you should hold each position. Even if you always sit with a small tilt or recline, you still need to fully get into the pressure relief positions to spread the pressure off your bottom. For each position, you will hear a recommendation for how far you should go. The most important thing is that you move as much as possible to give your skin a break. Pressure relief positions. Position 1. Standing. If you can stand safely with or without support, this takes pressure off your bottom and back completely. If you cannot stand, some equipment can lift you to standing. Some power wheelchairs are equipped with power standing, which pushes you into standing from sitting. Other items such as standing frames and sit-to-stand lifts pull you to a standing position from sitting. Position 2. Lying down. This does not take all the pressure off your bottom and back, but it spreads the pressure out along your entire body. If you are lying down for a long time, make sure to change position every 2 hours. Switch between lying on each of your sides and lying on your back. Position 3. Reclining in a recliner. This moves you from sitting up to almost lying down, but does not move the pressure off your bottom to your back the way lying down in a flat bed would. Because a recliner never becomes completely flat, there is always some pressure being placed on your bottom. Position 4. Hospital bed with head of bed elevated. Like reclining in a recliner, the pressure does not fully move from your bottom in this position. You may need to bring the head of the bed up for comfort and safety when breathing and swallowing while lying down, but remember that you might need to do more pressure relief as well. Position 5. Leaning. This can be done on your own or with the help of others to both move in and out of the position while keeping your balance. Lean forward and to each side as much as you can handle. Research says you should lean about 35 degrees forward or diagonally to fully take pressure off your bottom, which is a little less than halfway to becoming flat. When you feel your bottom come off the seat a little, you are getting good pressure relief. Wear a seat belt to prevent sliding out of the chair when you are leaning. Position 6. Forward lean. Lean your chest forward and use your knees, armrests, or something stable in front of you to stay balanced. Position 7. Side lean. Lean to each side, holding yourself up on the arm of your wheelchair. Be careful. While this takes pressure off from half of your bottom, it also puts more pressure onto the other half. Make sure to lean to both sides for about the same amount of time to take pressure off your entire bottom. Position 8. Diagonal lean. Lean forward and slightly to one side,